awesome professionals that bridge the gap in the bridge the gap with regards to well-being and health. Thank you so much for everything you've been doing. Thank you so much for what you will do. Thank you so much for being an answer to humanity. Good morning.
You are welcome, Dr. Naimot. We are glad to have you with us this morning. Shortly, I'll be coming back to you. But this is just to, again, welcome to the platform, dear nurses, once again. And since the last training on continence management, I've been in touch with all the facilities, and the feedback have been very encouraging regarding steps and actions that we have been taking to advance the objective of this project, both in the existing facilities as well as the new facility that will come aboard. So without wasting our time, so we go to the business of the day. We are not going to take much of our time, but it's very important to remind us that we observe all our rules as we did during the last training. I expect to see that we, even observe it better than the last edition. During the last training, we still had some participants who didn't, take into cognizance the location where they should be when participating in an online training like as this. So we still recorded some, background noise. So we expect that today is going to be better, and that we stand by the rule so that we can have a hitch-free session, and we all can, enjoy every bit of the, presentation. So, Dr. Naimot, I will hand over the microphone to you to share with our nurses, what we should know regarding, conveying information regarding COVID-19 and the COVID-19 vaccination, and the way that, our patients, our target patients for continence care service, we understand the essence of COVID-19 vaccination, and and to ensure safety as they receive access this care on the part of the patient as well as the caregivers. So over to you, Dr. Naimot.
Please, could you help me share the slide? Did you hear what I said, Mr. Fajemilo? Kindly share the slide, sir.
I heard you. I'll be doing that.
Okay.
Now.
Okay, sir. So because I didn't hear any response.
But okay. Please, Dr. Naimot, can you hold on a bit? Please, before we continue, let me say that this training has been possible through the support of Hope Primary Africa, or otherwise known as Ways for Africa Hub, funding the project, and the support of our UK partner, Spina Bifida Hydrocephalus Information Networking Equality. that's known as Shine UK. So, we are running this training owing to the support we have received from our UK partner, as well as the funding support from Ukumi Africa. Thank you. So over to you, Dr. Nanot.
Yeah, so good morning, everyone, once again. My name is Noimot Abisola Balogun. I am a public health communicator, one who made a transition from public health or health as it were into communication. And looking backwards to whatever caused the reason for this transition, I grew up in a community in Lagos. And I remember that there was a particular year, at this time I was about 16, when 3 women in my neighborhood died. They were all pregnant. And one particular pattern that was similar to all of them was the fact that they all did not utilize the formal health system. Now, this was rather very interesting because in my own community at that time, we had a primary health center that were just about some 2 streets away from us. So it wasn't definitely the reported information like, oh, distance is one of the things that delay healthcare seeking. They could just walk into this primary health center and seek for healthcare. But then it didn't happen. And the fact that one of them died earlier in the year was not even enough to make the second and the third victim not to fall prey. They still preferred other sources apart from the formal healthcare. And at that time, as a teenager, one of the things that kept reeling through my mind was, why would these people choose somewhere else? Why would they prefer to pay with their lives? Then I got into medical school some few years after. And in medical school, one of the things that was relatively glaring, which is still glaring as we speak, is the fact that social determinants of healthcare information, decision, and outcomes are not really being put into play when we design health messages, when we discuss health messages, and when we engage with some of our clients. And for that reason, I decided to, follow that particular niche. And that was what made me to go on for a PGD and master's in communication, respectively. So why are we here? We'll be talking about developing communal awareness, managing misinformation. So now, what's communal awareness? Communal awareness is a type of social skill that uses the understanding of collective norms, beliefs, and practices to influence health decisions and outcome. So what do I mean by communal awareness? What do I mean by the social skill? What do I mean by collective norms, beliefs, and practices? Now, whether we like it or not, I would decide to come to the health system or to the health center if I feel that they can sort out my issues. Now, my feeling is dependent on my understanding. So a lot of times what we tend to see when people say, hey, but people still come to use health now. People still come to the health centers now. People still come. A lot of times when people come to the health center is usually to seek for health that they don't have an option about. Let me give an example. Somebody that has been with the bone setter for like 6 months and the leg is now smelling. He doesn't have an option now. He has to go to Dobby. Because if he doesn't go, it is death that is, staring right in front of the person. The woman that has been going to the traditional birth attendants and then doesn't come. Eventually, when they rush her, so it's more or less like an emergency care. But in terms of an everyday care, where someone that is not maybe a diabetic, a hypertensive, and the person is already having symptoms, the person just feels I want to go to the health center to check myself, to see my doctor. It is not something that we are used to, that is so common amongst us. So communal awareness is that type of social skills that uses the understanding of collective norms, the beliefs, the practices to influence health decisions and the outcome. Next slide, please. Next slide. Okay, so we need to understand that Nigeria is a mix of decision makers. It's a multicultural setting that promotes communality. And so a lot of parents would make their decisions after seeking advice from their different social circles. We would have extended family members depending on how influential those family members are. The mother-in-law, the grandmother, the auntie that is the only one that is probably the auxiliary nurse in that area, the one uncle that everybody thinks is very educated, so he must know about health, the religious leaders, whether we like it or not, we are a spiritual society, and the clerics have a whole lot of influence on the way we think. Our social peer circle. So we have some friends on Instagram, some friends on Facebook, and you tend to see a whole lot of support groups on Facebook discussing if you want to use a particular cream that will not make you bleach, but it will tone your body to the right tone, whatever that means. You would see a group and people will join. We have school systems and others. And so this makes the receipts of information to be diverse with a possible influence on the child. Now using this Festus Fajemilo Foundation as a case study. So it means that a lot of times when a woman or a man comes to our health centers, they are many times not the only one that is making that decision. A lot of times, if it is not emergency, or if it is that the person is just coming to seek health, some people would have said, oh, there's one man that is down the street. That man, we be jebeni. There's nothing that man cannot do. There's one mama, that mama like this, if she gives you something like this, you know. And so I tend to tell people that even with religion, a lot of people are actually multi when it comes to the places where they seek. People seek for all sorts. Election time is coming, you would see a whole lot of stuff. And so you realize that people seek for a whole lot of things, even when they profess what they profess. And this is what defines our communality. The next slide, please. And so understanding where we are and where we're going, understanding that we are not like some of the developed, societies where people already, based on the very high level of health promotions and health campaigns, people can walk into, research institutes and say, I want to be part of a trial. In Nigeria, you will practically, force people to be part of research. You practically have to beg people, you practically have to pay people to be part of different intervention programs. And as such, health workers have to be seen as a helper rather than a critic. What am I saying? Are we going to then start saying what they are doing is right? Nope. But we have to be seen as that particular influencer who is always willing to help, if only you would come to them. Next slide, please. So in trying to see the health worker as the helper, we need to understand that we would have to look at perspectives. And then I ask, whose lens are you using? When people say, oh, I'm not going to the hospital, when I go there now, they'll start judging me. If I go there now and I say, I want to do family planning, they will judge me. If I go there now and I say, I want to do this, they will judge me. So which particular lens are you using to have your discussion? remember that whatever it is that is sick to you may actually be benign to the next person. So the woman who suddenly comes 6 weeks after the last birth, maybe there are some
Hello, Dr. Neumann. We lost your voice. Hello, Dr. Balogun. Okay.
Hello.
Okay, you are back now. So can you go back? Because we lost you at some point.
Okay, so like I said, understanding perspectives, whose lens are you using? It's very important because sometimes there are, I went to medical school too. So some of these things I'm talking about, I'm not a communicator that people would say, oh, it's because you are not a health worker. It's because you don't know how it is. I was in medical school. I still work as an adjunct research fellow in the Medical Research Institute. So I have an idea of the many issues that how these things work. So when somebody comes and then the person is saying, oh, I'm back again, the person is back with pregnancy, and the thing is, are you for real? I told you the last another baby, this. The question is, maybe we need to begin to first map out the social determinants for that particular woman. If she's one person who is in a family house, whose husband
So apology to all the participants. So let's wait to have Dr. Balogun back with us again. So seem to be having challenge with network today.
Hello? I am so sorry. I keep getting pushed out. I'm using my phone now. I'm going to use my phone and my laptop so that any of the two.
So if you can just go back a bit.
Okay.
On some of the things you have said, yes.
All right. So okay, so now this is getting all right. So like I said earlier, I mentioned that for every person that comes to your health center or your tertiary institution and all of that, we need to understand that everyone is peculiar in itself. So one of the things that I have been able to debunk many times when I engage with some of my medical colleagues is the fact that some of the documented different reasons for delays for seeking healthcare, like we would do maybe when somebody is doing masters in public health,
may not essentially work in our own community as we speak, because we are beginning to have a lot more emerging determinants. Social media sometimes ago wasn't a determining factor, but right now you would see, I mean, a lot of us have moms and dads, and if a lot of people are like my own mom, I get videos every day, almost every day, talking about one health stuff or the others, and I would say, Mommy, where did you get this? So we realize that the perspectives then means that for each individual that comes your way, the determining factor for the health decision that person makes is based on many factors. It's based on how religious that person is. It's based on the kind of worship center that person goes. It's based on the kind of media, social media that that kind of person is in. It's based on the kind of peer group that the person goes with. Whether we like it or not, we have different. So at the end of the day, there has to be an understanding of the perspectives that, okay, for this woman who is able to do family planning, maybe because she's in a nuclear unit where every other person in the family doesn't make decisions for them. For the same woman, for another woman around the same area who stays in a family house, whose husband has to table down many of their needs, health needs. Oh, this is what is happening now. Where should we go to? In front of the family members, the ability to make up her mind for health decisions will not be the same as the first lady. And as such, understanding those perspectives would make it easy for us to know why some people would say, I'm not going to take the COVID vaccine. I will take it. I'm not taking it. They said I should not take it. I would have loved to take it too, but my cleric said I would have loved to take it too, but this is what they sent to me through WhatsApp. Those are all the different perspectives that would come up. Next slide, please. Okay, so now that we know this, we need to understand the core issues. And what are the core issues? We need to understand that when it comes to distorted information, there are two types. It isn't just enough to have a distorted information. It's also good that we understand the source of this distorted information. Now, there are two types. We have the misinformation and we have the disinformation. Now, for disinformation, I'm starting with this first. So now for disinformation, it is a deliberate attempt to change the narrative. So let me give you an example. Oh, people have said, maybe somebody used ginger during the time that the person was having COVID, and probably the person still used, malaria drug and all of that. And somehow the person was able to get out of the COVID issue, maybe because of a higher immunity. It is not going to be the same way with an asthmatic who is also diabetic, who maybe is also hypertensive, having the same issue. Taking ginger will not work for someone like that. But guess what? The ginger seller wants to sell. And as such, you tend to see people now saying, people have started telling you that you should come and take the COVID vaccination, it will reduce severity. It's a lie. When the governor of Kinikon State had COVID, it was turmeric and black seed oil and ginger that he used. When this, that is disinformation, because that person is deliberately attempting to change narrative simply because he realizes that if we allow people to take this vaccination, they will not be able to buy all our products again that we have been selling to us since, and he wants to make his profit. So that deliberate act is the disinformation. Now, the misinformation is also a false information, but the difference is that that person isn't intending to cause chaos. The person, in fact, in some cases, just wants to share to family. There are those ones that we call natural sharers or natural forwarders on social media. They see anything, they don't bother verifying, they just share. They share to families and friends, to enemies, to foes, to anybody that comes their way. Those kind of people are people that, so those are misinformation. They are wrong information, but there isn't any deliberate attempt to malign the health system. Now, why do we need to know this difference? We need to know this difference because it's going to make it easy for us to engage our clients when they come with this form of narratives. When someone who already told you that I sell avocado, I sell turmeric, I am a, what do they call themselves? I am a natural doctor. You know those names that they call themselves when you go to the market. Dr. Kiniko, flusher. The flusher helps, it takes care of diabetes, it takes care of hypertension, it takes care of syphilis, it takes care of streptococcus, it's just one particular flusher. And that flusher, it actually takes care of like 20 ailments. So those kind of people, they are not ready to take the vaccine, and they don't want people to take it. So if somebody is quoting such kind of people, you know that it is from a commercial point of view. It's not as if they have the health or the well-being of the clients in mind. Now, when we know these sources, it's different from somebody that says, oh, I got one particular video, and in this video, they told me that if somebody takes the COVID vaccination, that particular vaccination, so when somebody puts spoon by the side, it became metal, the kiniko, and all of that, you would know that those ones, they're just scared. They saw some of those things and they are scared. They don't want a situation where they will be affected because they want to take the COVID vaccine. So I hope these sources are clear. Please, can I get some yes or no from the audience?
Yes, we get this type of information.
Okay, ma'am. Thank you so much. Okay, so that takes me to the next slide, please. Next slide. So now, understanding the core issues, we will then understand that there are different sources. We have the Uncle Adisa or Uncle Emeka or Uncle Abu that are selling things, and those people too would want to sell. They can tell some of the clients that this particular thing that they say you should come and take, they want to use it to reduce our population. They want to reduce our sterility. They want to do all of that. Those things will come. We have the spiritual community. Now, one of the things I usually tell a lot of my colleagues when they want to start, programs or initiatives is you need to get the buy-in of some of our spiritual leaders that have been respected over time. When we get their buy-in and they show support for this kind of initiatives, it gives a positive, tie back to many of the different congregations that are under them, because they feel, oh, if Pastor Adeboye can take this vaccine, if Imam Abrahman Hamad can take this vaccine, then it means it is okay. If Reverend Kuka can take this vaccine, then it means it is okay. The reasons are because a lot of times people want to be sure that what they are taking will not take them away from their goal of afterlife. And they are valid. And so one of the things I tend to tell my colleagues, and I believe I'm talking to my colleagues here too, that there's no point trying very hard to water down the belief of people. People hold on to what they feel they're about. So you're just going to be wasting time trying to change that belief. They would rather move away from you than you telling them not to do what they hold dear. So one of the things we can then begin to do is to acknowledge what they believe in and then show them I understand the fact that we need to pray because prayer actually works. However, God also says when you tie your camel, you pray to him. You do your own effort. If you are going to do exams, we will read for our exams and we will pray to God. So for that reason, I'm saying when they have said that this vaccination can reduce the severity of the symptoms, even when you eventually have the COVID, why not let us continue praying and at the same time do our own bit by going for this vaccination? If we notice, some people have taken this vaccination since about a year ago and nothing has happened to them. Of course, we are not saying that you will not see some bit of symptoms immediately you take the vaccine. Even children, when they go for polio vaccination, when they go for hepatitis vaccination, some of them would have some bit of pain. Some of them will be irritable for a while, but those things go away. So even if you have some bit of pain at that point, or some bit of general body weakness, it's just for a while, it will go. But guess what? The outcome at the end of the day is, should we eventually have COVID, for people that will probably have exposure, it would at least reduce the severity. What have you done? You have acknowledged their spiritual belief or concern, and you have also shown the benefit of what you also know. So one of the things I think that we need to do better going forward is understanding that people will always be who they are. Even in developed countries that we are talking about, didn't they also have conspiracy theories? The first video against this vaccination was by, even though, yes, she's probably Black, but she's also someone that trained abroad, is in the US currently. And she was one of the people that actually, whose video went viral against vaccination. So it means that misinformation is not education specific. It's not because of these people have lower education strata. No, even educated people can be misinformed. It means that misinformation is one thing that goes across social class, across educational class, across strata. And as such, I say, if people believe, but they said when we take ginger and turmeric and this and that, I said yes, ginger, turmeric, black seed, all the coconut oil, all those things that people are saying, they are natural body supplements. They are natural body supplements. They are natural spices that over time, based on research, have shown that some of them have antioxidant abilities. So yes, they may be stimulants in ensuring that your immunity is improved. However, it's always also good to use what has been researched and has been found to be scientifically evident. So while you are taking your turmeric and ginger in your food, please do well to take the COVID vaccine. And you are sure that relatively within our own level of efforts, of course, God owns the supremacy, but within our own level of effort, we have done our best in ensuring that we take care of ourselves against COVID-19 virus and other emerging viral diseases. What have we done better? What we have just done is to be able to say, okay, we acknowledge that some of the things that you have to, because really, some people have said they took those things really, and it worked for them. But we know that people are different. Our immunity systems are different. We are all are different. So a 60-year-old man is different from a 20-year-old man. A 60-year-old man who doesn't have asthma, hepatitis, hypertension is different from a 30-year-old with those kind of chronic diseases. And so we need to be able to give those people making
Hello, Dr. Balogun. We are not hearing you again. Yeah, you are on the platform, but we cannot hear you.
Yeah, we need to wait for Dr. Balogun to reconnect so that the training can proceed.
I mean, I loaded this particular thing. I don't know what's happening. I'm sorry,
Okay.
it used to be my guest, so sorry. So like I said, so this takes me back to the experience sharers. Now, when one of the things that the health systems need to do much better is ensuring that those ones that at least come around for this COVID-19 vaccination can report a better user experience. What is this better user experience? First, I was thinking of it that at least everyone should be able to be given, should be given a flyer when they finish this vaccination, telling them these are some of the things that you may experience. I mean, when I go to buy, what's it called? When I go to buy drugs in the pharmacy, for every drug, you would find a pamphlet inside it that would tell you, oh, those are some of the side effects. Those are common side effects. Those are rare side effects. Those are this. For people that read those things, if eventually you see some of those issues later, you would at least know that, oh, they said this can happen. A lot of times, the discussion that was had when I went and I said, I mean, I've gone 3 times. Some of those discussion is, oh, go and have you eaten before you take that? Can you go and eat something? Then they eat, then they take it. Unlike the way you tend to have the antenatal clinic, where you have health talk before people see the doctors, we don't tend to see that when it comes to COVID vaccination. It's more or less like a walk-in, get your vaccine, walk out kind of thing. Now, we all know that people's threshold for pain differs. We all know that people's allergy level also differs. So if somebody who has told his family and friends that is going for COVID vaccination, then gets home and all of a sudden start to have the body ache, maybe he sees that, oh, I'm maybe eating much more. Maybe he sees that I am sleeping, I am this. And it wasn't as if there was anywhere where they told him that, oh, those things are normal, they would happen, and all of that. You would realize that he doesn't even need to tell any other person. The family members that are there, when they saw him when he was going, and there was nothing wrong with him, and they saw him when he came back, and maybe he was already shivering, he's keeping himself in like 2 days, and they said, I don't want to take this COVID vaccination. The thing that you take that, you become sick. So I think that we need to do much better as health workers, even if it is even if you can't do it as one-on-one. At least these people would have sat down in coming for the COVID vaccination. Can we just do a small bit of 5-minute health talk? Oh, thank you for coming for this COVID vaccination. You are part of the people that are ensuring that we are getting the herd immunity so that this thing will not continuously affect us and they will tell us to go on another lockdown. However, just like every immunization, if you took tetanus toxoid, if you took this, you may have some bit of pain at the site of injection. For some other people, you may have some basic body malaise or general body weakness, but this doesn't really happen to everyone. Some people may say this thing makes them sleep. People have reported that they sleep more. People have reported that they eat more. Some people reported that he probably had issues with their menstrual cycle. Even though those things have not been scientifically confirmed, it has, however, been reported. Should you have any symptom after you have taken this COVID vaccine within 24 hours, please come back and let us listen to your worries. Just 5 minutes. It's going to make a whole difference, because guess what? The worst set of people are people that have taken it and telling others not to take it too. Even if they will not listen to the others that have not taken it, the one that has taken, say, this one has taken it and is even telling us not to take it because of the bad experience, so to speak, that person had. So these are part of the things that we may need to do better. Please, let's just do a joint 5-minute talk that at least makes them to, when we go to NIN center, when we go to the bank, when you sit there in a GT bank, as you are waiting to get, you see all of the everywhere around telling them, you know, around telling people, oh, if that is what, so those are all the different issues, you know, and we need to talk about it. Next slide. I took time explaining that because I mean, that is what is expected of us as health workers. Next slide, please. Next, so how do we deal with it? We need to acknowledge, understand that human beings, especially the public like Nigeria and Sub-Saharan Africa, we are inundated with different sources for health information. The mother-in-law who was the first person to give birth to the auntie in the community who is like the slay queen there, everybody listens to her, to the auxiliary nurse in the community that everybody calls Dr. Sef, to the person that owns the drug vendor that everybody calls pharmacist. And the list goes on and on and on and on. And those people are not going to go away. And the breaking news is that those people are closer to them than us because those people live with them. Those people say their slogans. Those people understand their struggles. So those people engage with them from an understanding of their struggle. Let me give you a very good idea. I usually use the Moluwe strategy to explain this and explain social marketing so that we would understand what is at stake. I understand the fact that a lot of us are healthcare professionals. So maybe we may have our cars, maybe we may have, you know, we do Uber and all of that. But for someone like me that does public transport, I mean, a lot of times I do public transport to be able to have an idea of what happens in the different communities so that it would inform what I do when I'm writing an advert for my clients or a brief for my clients. So let me give you an example of what happens in the regular long coastal bus going from Ojota or Ketu to Ikorodu in Lagos State. Apologies for people that are not in Lagos. I really do not know where else to use. I stay in Lagos, so I may not be able to have an idea of the motor parks in other places. Kindly indulge me. So when you enter the regular long bus or Moluwe from Ketu, just as you're entering, there's someone just around, not very far from where the conductor would stay. In fact, you would mistake that person for the conductor. And as you want to come in, if you're somebody that has a child on your back, the person says, be careful so that the child's head does not hit the roof of the car. And then you say, thank you, sir. So the person says, there's a seat there, go and sit there. And then the person says, oh, madam, there's another seat there, go and sit there. And then the person says, oh, excuse me, boy, go to there and sit the seat, you know. So before you know it, that person already gets your attention that, oh, this person was the person that helped me when I wanted to enter. And the bus eventually gets filled and the bus wants to move. And then the person says, remember that we're a religious nation. We're a spiritual community. We know or we believe that when we want to travel or we want to go anywhere, we need to commit ourselves to the hands of God. And so the person says, so we are starting today, we are going on a journey, there is no small journey. And so for that reason, let us commit ourselves to God. And the person begins the praise and worship. And then little by little, everybody, you know, we start to get into it. People that do not get into it start to move their head a little. People that are, you know, natural singers just get into the groove and everybody sings and we just go on. And then when the person finishes, the person does a small prayer just so that, we are covered, And then the person then says, I would love to say this in Yoruba, but I realize that there are quite a number of other institutions here that are not Yoruba based. So I will still try very hard to say this in English. So the person says, my mommy, my daddy, I am here for you today. Now, one thing I bring common. There is one Ogbonge drug that I have today. This drug, it has been tested and trusted in many countries. This drug, they said, in fact, by the time you use it, this drug has been used to take care of diabetes, has been used to take care of hypertension. This particular drug, when you use it, Oga will be asking you, whatever happened to my wife because you are looking fresher. Even the auntie will be asking Oga that, you are doing well in the other room. Even everybody, is it menstruation? Is it syphilis? Is this streptococcus? This drug does it. And the thing about it is that this drug, you can take it with pap. You can take it with 7-Up. You can take it with water. You can take it with hot water. You can take it with gin. You can take it with anything. No be juju be that. And then they now say, before, this drug used to be 500 naira. But now, because, the makers of this drug, they are very bothered that, the way this country is going, we have to make things easy for people. So for that reason, this drug is going for 3 for 250. 3 for 250. It is no longer 500 naira for one. It's now 3 for 250. Buy your own and thank me later. Buy for Oga, buy for mommy. I have seen, but my mommy has bought this kind of drug for me before. She brought one for herself and she brought one for me too. At the end of the day, what has this guy done differently? Social marketing. Social marketing, because the very first thing he did was to even give you that sense of belonging. When you wanted to enter the bus, trying to pave way for you, helping the woman with the load, helping the woman with the child, and all of that. That is engagement. That is entry. The person has entered into you. And then the person understanding that we are also a religious society gets to you through God. And then the person says, this is what I am selling. So even by compassion, by feelings, by sensationalism, you just see yourself buying some of those drugs. They always sell. They've been there since I was young. They are still there. If you go through K2 to Ikorodu today, you will still find them. So why is social marketing of these informal sources working? And why is ours not working? Those are questions we need to ask ourselves. So maybe one way of starting is it people come for the COVID vaccination, let them know what they are going to, that they may likely experience when after taking this vaccination, so that they do not become our critic after believing in us. Next slide, please. And as such, I'm going to end it here by saying one best way for us to do this is pivoting. We are not going to remove the validity that we, for people that believe in God, they actually need God in their lives. We're not going to remove that validity. So we're not going to attack spirituality. Rather, we are going to understand and acknowledge that we are in a multi-plural setting. But even within that, we will still be able to lay out our own facts using the slogans that our people understand. So all those slogans that they say around us, no go collect wutu, problem no they finish, he choke. Sometimes we'll use some of those things to engage some of our clients. Mama, auntie, say you get diabetes and asthma. Go and take your COVID vaccination because go on collect woto. If this thing happen, breathing is one of the things that will be affected. And already with your asthma, your breathing may be difficult. So go on behave like another person outside there, And as such, we are giving them the right information. We are not messing up their head with the information that they are bringing. Those information, we are not wasting our time trying to change them. We are just saying, okay, I have listened to everything you have said. However, let me tell you the benefits of COVID vaccination. Can you see that? I have listened to everything you have said. However, let me tell you the benefits of COVID vaccination. These are benefits that have been scientifically proven. So kindly listen to me, and just maybe you will find them useful in the nearest future. And then you say those things. So pivoting is one of the best ways to engage our clients who are coming from different multicultural and multi-plural sources. Last slide, I guess. I think I'm done. Yes. So at the end of the day, no, please go back to that risk communication. Risk communication now. Thank you. So at the end of the day, risk communication is a strategy in which an individual, group, or organization maintains a continuous level of engagement with its intended audience in terms of its risk factors, its risk and perception. Remember what I said about the man in the Molue? It was a continuous engagement maintained right from the time that woman enters the bus till the time that that woman leaves the bus. Right from the time the woman enters the bus till the point that the woman leaves. So we also need to, at least, even though we don't have enough time to engage each of our clients one-on-one, we can at least try and work on dual engagements where we talk to a lot of people at the same time. Families and children with special needs, such as some of those that are being catered for under the Festus Fajemilo Foundation, may need to understand this idea of the COVID vaccination, especially for people that are more than 18. Why? Because sometimes people with special needs may have some debilitating diseases that would affect and would make issues worse should they have the COVID-19 virus. So we should at least discuss this COVID-19 vaccination with them and the different benefits. Their therapists should also have an idea of how these things work, the symptoms that can happen, the schools and the social circles. Next slide, please. So my question to my wonderful senior colleagues, junior colleagues, peers, and everyone here, are you ready to sort out the mess that we have out there? Because it's really a mess. Everybody is now discussing health. Everybody has become a doctor. And they call them doctor and they are so happy to answer. They call them nurses and they are so happy to answer. They call them, a lot of times when you see people that are not the auxiliary, they call them nurse something and they answer. So now that we know that we have a lot of competitors out there, how are we going to sort out this mess? At least when they come to our clinic, when they ask us for information. Did you know that a particular survey done, I think in 2020, showed that the public actually accepted and concluded that indeed, when it comes to trusted source of information, the health workers in the formal health settings have them. The reasons why they don't come to meet us first is now why we need to start to decipher. Thank you so much for listening to me. Apologies for the breaks that kept on happening. I take responsibility for that and I sincerely apologize. Thank you so much. I'll be very available to answer questions. Bye.
Yeah, thank you so much for that wonderful presentation, Dr. Balogun. I believe that this is a two-in-one package for our dear nurses and for some of us in the development sector as well. Having knowledge of continence management, as well as how to, I mean, the skills to pass information, the right information regarding COVID-19 vaccination as we engage with our patients. You agree with me that Dr. Balogun dealt with the topic, explicitly. I so much I was amazed with the local experience she shared regarding the public transportation in Lagos, particularly the quote and unquote good Samaritans in Molue. So Molue is a particular type of commercial buses in Lagos. Though I think in the last 2-3 years, we have not, I mean, the government have been trying to phase them out, but what we now have is the long buses, which are modern than the rickety Molue that we used to have. And how these good Samaritans, quote unquote, used to get into people to get their attention and I say in a way lure them into believing in their message. And before you know it, I mean, some of us have really fallen, been a victim of that before. And so many times we bought some of these, we call them Bubu Nishe in Yoruba, that is, the one that does all. So you heard Dr. Balogun said that when by the time they begin to do what you call social marketing for their herb, you heard them that, oh, this herb can cure up to 20, 30 ailments. So for us as health workers, so we now know that it is not just by the fact that we are health workers, we are nurses, we are doctors, physiotherapy or therapists, or specialists in one medical field, that we make people believe us, when we are trying to pass information about COVID-19 vaccination. But the way to we need to have the skills, we need to have the knowledge to be able to pass out this information, and not to try to, to deal with facts and not the fake, and not to try to twist or contend with the beliefs of our patients, but rather focus on the facts and get the right message passed. So having said that, we opened the floor for questions, so that we can there are one or two areas that some of expectation or concerns as regards engaging with patients regarding COVID-19 vaccination, that probably Dr. Balogun hasn't mentioned, then can have more insights. So the opportunity is open now. So you can unmute yourself, raise your hand, then we call on you to ask your question. So it's question time. Anybody? I will stop sharing the slide so that we can all see ourselves. Questions? And you can also drop, use the chat box to drop your questions, whichever one works for you. Questions?
Good morning, all.
Good morning.
Yes, I'm Imokwede Olukwakemi. I want to thank Dr. Balogun for the lecture. And it's not a question per se. The lecture is simple enough for everybody to comprehend. And it's just like a charge, like a reminder for us to go and do it well if you've been doing it well. If you've not, go and, use the kind of example she used. We all know the challenges we face, whether any part of medical health you belong, medicine, nursing, pharmacy, whatever. So it's just to go out there and begin to use some of the, this method if we've not been using it. I want to say thank you to her and thank you to the organizer, FFF and group. We really enjoyed it. So the message is simple enough for everybody to comprehend. So it's not as if the lecture is not clear. That's why we're not asking questions. Thank you so much, sir. And thank you, Dr. Balogun.
You're welcome. Thank you, ma'am. Yes, Mrs. Oje, can we have you? Please unmute your microphone.
Yes, good afternoon, everyone. Thank you for the opportunity to participate in this presentation. Dr. Balogun, we appreciate you. The thing is that those marketers, they apply social intelligence. As she said, they use it to draw the attention of the commuters, render assistance where necessary before they come out precisely on what they want, the message they want to convey to them. So if we, irrespective of the work pressure we have in our respective facilities, we're able to have control over the pressure and show them love to us, and they'll be able to ask us questions. They will feel free to ask us questions when need be. But because some of us are irritated because of the pressure of work, we scare them. And when they come to us, even when some women are in labor, some of us use harsh words on them. That's not time. Gone are the days when such practices should be. So we have to learn from these other group of people, even the traditional birth attendants. They all use such strategies. They are down to earth. They listen to the complaints of the clients. And somebody who listens to you, who smiles at you, when you have need for any health challenges, you will be forced to go to the person because you know that the person will listen to you and will render a proper solution to your problem to some extent. So it's a food for thought for all the healthcare practitioners. We know we have shortages, but be able to be in control of your temper. Thank you. That's my submission. Thank you very much.
Thank you very much, Mrs. Oje, for that piece of advice.
Yes,
that's a very good one.
And if you don't mind. Thank you so much. Okay, ma. Thank you so much, ma, and for the first person to thank you so much. I really appreciate it. And trying to reiterate what she just finished saying, the situation is even getting much more. Like a lot of times when people come and they go, the reason why we are not doing this is because this, I said, well, whether we like it or not, a lot of health workers are traveling abroad. And I know that one of the things that you would have to do for at least the doctors that I know, when you're doing PLAB 2, is one of their core areas is the counseling, when you counsel patients, when you do all of that. If for whatever reason you travel abroad and you change, knowing fully well that there's a system there that can mess you up if you did it anyhow, then it means that thing is not good enough. It means it's not as if it's cast in stone, it's not as if you cannot change. That's one part of it. The second part of it now is that we are in the era of social media. People take videos, people want to trend, people want to post a viral video that will trend. Imagine after all the work that we have been doing since all these years, even if nobody is looking at me, maybe I'll just hold on and allow God to reward me. But at the end of the day, it's just maybe one time when I was harsh or I said some very, very bad words to a pregnant woman, somebody took my video and it's right there online. You know how that thing works. I have gone for fellowships and programs abroad. One of the first things that they would do is to tell you to put your social media there. That name will pop up. And imagine that the only video they see about you is the video where you were entirely not doing well as a health worker. So right now, there are a lot of eyewitnesses accounts. Even somebody that has accidents, that people are dying, the person is taking video. Not to not talk of a health worker and a client and their issues. So what I usually tell people is at the end of the day, by the time continue doing this thing and somebody picks it and posts the video as an eyewitness person, it would so mess somebody up. And imagine your career that you have worked on for a long time being messed up simply because of just one 5-minute discussion that could have been sorted out. So telling people, if you know, say, you know, want to give birth, why you allow your husband sleep with you? If you know, say, you know, all those things, they are now things. Nigerians are becoming aware of user experience. Nigerians are becoming aware of social media reviews. If I don't know if some of us are on Twitter, but if we saw what happened with the Arise journalist that, you know, went on one way, at the end of the day, he had to make a public apology. For someone to make a public apology is because that pressure is high. He could have lost his job. So things are not like it used to be anymore. Things are not like you will just do it and people will move on. That person that you do not know may just have an Android phone and the person is taking your picture, taking your video. So it's not worth it in any form. And we can decide to change the narrative. Thank you.
Thank you very much, Dr. Balogun, for buttressing that comment from Mrs. Oje. Do you have any further question?
Yeah. Yes.
Okay, Mrs. Alade Loye. Your question, please.
Good afternoon, everybody, and thank you, Dr. Balogun, for the wonderful lecture. I just want to add to what other just an advice. You know, most of us in Nigeria, we seem to say that we are religious. So whenever we are taking care of our patients, we should put this also in consideration. Even the God that we are serving, we have Christians, we have Muslims. We ourselves in the condition of the patient that we are taking care of, so that God will reward us in like manner. So God will help all of us. Thank you very much, sir. Well done.
He said that.
Thank you, Ma.
Now we want to ask questions. We should click on this. That one is when you want to unmute. You're under this chat here.
Yeah, we can hear you. Go ahead and ask your question. From Risut.
Yes.
Good morning, Dr. Balogun. Thank you for your good presentation. Since we are identifying one of the sources of distortion, my name is Koroke Bridget, Children's World Research. Since we have identified one of the sources of distortion of information, I think in the outbreak of any disease condition, we need to incorporate the leaders of the church, seeing the public have their leaders in high esteem. Because if the leaders tell them that they should embrace any vaccination, they will. So we should incorporate them when there is any outbreak of any disease condition that requires vaccination. Thank you.
Another question again, please.
Okay. Go ahead.
Okay, still under the sources of distorted information, I want to know what we are to do under the drug vendors and the conspiracy theories. What are we expected to do? That's what I want to know, please.
All right, thank you so
much. Please.
Yes, ma. Thank you so much, ma, for the very valid question. So now, one of the things that maybe I should just quickly mention this here, that when we talk about conspiracies and misinformation, we are like a set of people, they call it a diffusion of innovation theory. And this diffusion of innovation theory says that for every time when a new thing comes, a vaccine, an intervention, there will be some people that naturally, they are very curious. Let's even go and see. Let us be part of the people that would, that would be the first set of people to try it out. What if you die? No biggies, let's try. There will be some that would say, let me see the others. Let me see if they die. If they don't die, then I'll go and take it. There were people like that. My own husband waited for me to take the vaccine first before he took. So there are people like that. There are also some people that they are neither here nor there. They are just, there are people that you can easily convert. They're just waiting to see, okay, let's see how this thing goes on. You would see it. Now, there are some who, for whatever reason, maybe earlier experience, maybe a particular health worker has done something to them. Those ones would tell others not to take. Those are also some of the people that are selling things. They will tell others not to take. But if you are able to convince them at the end of the day, they would be your best form of information sharers. Some of those people are clerics. Clerics may say, oh, you shouldn't do this thing. But eventually when they get, fully informed and they are sure that, oh, this thing is not going to injure us. I think one set of reasons why the clerics had issues with this COVID vaccination, was that they were part of the people that were mostly affected during the lockdown. If you remember, people couldn't go to churches, people couldn't go to mosque for days, for weeks, for up to like 2 months. So that really affected acceptance. But eventually people came around and it became better. Now the last set of people are now people that no matter what you do, no matter how much you try, those ones will not accept. Those people are people that's the reason why for every time when they talk about research, when they talk about vaccination, when they talk about intervention, they call it the 70% herd immunity. If 70% of people can believe, those lower percentage, our immunity will cover them. Because trust me, there's nothing you can do. They will still not believe. However, when some of those people come in with those conspiracies, like I said, what we do is pivoting. Oh, they said that if we took this thing, it will become metal. The metal can even attract magnets. This. You would say, yes, a lot of things have been talked about with COVID. And those things are actually, they are not things that you can say it won't happen. Why? Because COVID came in as rather a strange thing. And because of that, the vaccination process was faster than normal because they gave a lot of approvals faster than normal. So it's normal for a lot of people to be concerned, to be scared. However, what have been scientifically proven are that this vaccine has been used in different countries, tested, and the safety is much more than even 95%. This vaccine have been shown to really reduce severity. It will not stop you from having COVID if you are exposed, but should you be exposed, it would reduce the severity such that you may not need a ventilator or having to be under hyperventilation for a long time, So you would tell them the facts. You would acknowledge that, yes, those conspiracy theories are there. However, they have not been scientifically proven to be true. Let me discuss with you some of the things that have been scientifically proven to be true about COVID-19 vaccination. I hope you get it, ma, and I hope this answers your question, ma. Thank you.
Thank you very much, Dr. Balogun. There are still questions. Are there still questions? All right. Okay. Risut, yeah.
Still concerning that question, she answered the conspiracy theory that the drug vendors, what do we do to them? I'm not clear about that.
Oh, sorry, I forgot about the drugs. That's true. I forgot about the drug vendors. Thank you. Okay, so there was a time I did a project with I think it's Integrate E. The Integrate E program, I think they look at family contraceptives and all of that. And I know that from that particular consultancy, I was able to understand that, before I just used to think, these drug vendors were there, but they actually have a structured association where in their association, you even have the different tiers. Drug vendors that are maybe the ones that have OND, the ones that do not have OND, the ones that are literate, the ones that are not literate, they have such kind of strata. And one of the things I think what we need to do as management, especially where those drug vendors are very popular, is that we need to, as a matter of urgency and engage, have discussions with the association. Now, let me tell you one of the things that has worked in some of the projects that I did, and I discussed with some of my clients. So when they said, oh, sometimes when we want to engage them, it's hard, it's difficult, I said, just like we said earlier, it's social intelligence that you would use for those people. Whether we like it or not, some of these people also want to get some bit of international recognition. And one best way to get international recognition is when you have a local recognition. Because if you're applying for a fellowship, you're applying for this or that, or maybe you're applying for a partnership, a particular drug, pharmacy wants to bring in drug to Nigeria, they would look at your earlier certifications and recognitions. So one of the things I tell tertiary institutions is, can you invite some of their, management, their association executives, invite them and tell them that there's a need for us to have COVID-19 vaccination in our different regions, and then make them to be part of the mobilizers. What do? You now tell them that you realize that people come to see them because they are the ones in the community, and it shows that their importance is noted in the community. So for that reason, if they are able to refer people to the hospitals for vaccination, at the end of the year or at the end of the quarter, we are going to be giving certificate of recognition for being COVID-19 referral ambassador. Don't get me wrong. I didn't say for being the best drug vendor. For being COVID-19 referral ambassador. And frame it for them. They can put it in their shop. You will see that it will become a competition. How did Ashwebi become a big deal in Nigeria? Such that when people don't even have money, they will go and borrow money to collect Ashwebi. It's because if you go to parties, if you don't have Ashwebi, you will not collect things. So they will continue passing all those things above your head. So Ashwebi now has become a mainstay because Nigerians are, whether we like it or not, competitive by nature. So by the time you start and you recognize a drug vendor that has done the referral, and how do you recognize them? Just tell them to come. The CMD or the CMAC gives them the certificate of recognition as a referral ambassador and take the picture. He will post it in their WhatsApp group. By the time he posts, the others will start saying, hey, maybe that Inkena is going to use this thing to get more opportunities. So let me start to refer people too. So instead of giving them drugs for COVID-19, they will start to refer. It's a social intelligence that we can use to engage them. Thank you so much. I hope this answers the question.
Thank you very much, Dr. Balogun. I can see Techno Spark 7. Please unmute your microphone and speak. Techno Spark 7. Owner of Technospark 7, please unmute and ask your question. I believe the person has, or you can drop your question in the chat box. Sorry? Okay. All right. So thank you very much again, Dr. Balogun, for your time and for the wonderful presentation. Very educative and informative. Going forward, we better position health workers in conveying COVID-19 vaccination messages in a way that, patients are able to understand better and the importance of uptake of this vaccine. Thank you for your time. You've been doing this for Festus Fajemilo Foundation, and I believe that when next we call on you to share your professional experience, again, you will be willing to respond to our call.
Absolutely.
Thank you very much. So you can, yeah.
And SARS, it's been nice hanging out with you in the past 1.5 hours. I really appreciate this opportunity. I really hope that this can be stepped down to other health workers. And let me just use this opportunity to say, I'll be happy to also come around to your hospitals if you want to do maybe some of those engagements as health workers, or probably during your conferences and all of that. Thank you and have a wonderful day ahead. God bless.
Same
Thank you
here.
very much.
I appreciate you. Thank you, Mr. Fajemilo.
So,
You're always there to give us stuff on different occasions, on different topics. We appreciate you.
Thank you, Mrs. Oje. So just before we leave the room, some pieces of information to share with us again. First, I would like to use this opportunity to remind us of the continence working group meeting, which we hold quarterly, especially for the new facilities on board. So we've already shared the information regarding notice regarding the dates on the platform before today. So that meeting we hold on the 25th of this month at 3 p.m. But in this meeting, we are asking that each facility we nominate 3 persons in the team to feature in the meeting. And during this meeting, we have, like we said during the online continence management training, that we use this meeting to share like peer support among our professionals, to share knowledge, successes, challenges, and promote best practice regarding continence care services in various health institutions. So we expect that 3 persons will be nominated from each facility, and we'll be happy if we can receive these names on or before Friday this week. So please, the focal persons from each facility kindly avail us these names so that we can begin to engage with them. And we also expect that During this meeting, we also share reports of the continence care activity in our various. So this is where we listen to what has been happening regarding the provision of continence care for patients in our various facilities. For the new facilities, you know that we know sure that you have not commenced the practice, but as regarding what the training we had, but one of the things that we would like to hear from your facilities, perhaps there have been step down training among your colleagues. Okay, that will be something that we look forward to see and hear during this upcoming meeting. So for the whole existing facilities, so please, your reports, written reports, you will share with the present at the meeting, and we also share with us so that we can share with our partners as well as the donor. The essence of feedback and reports is to show to the donor what we are doing with their resources and the impact their resources is making in our society, so that when next we call on them, so we always have their ears. Also, concerning the practical, on-site practical demonstration training, this concerns University of Abuja Teaching Hospital, Rivers State University Teaching Hospital, as well as University of Benin Teaching Hospitals. So I've been speaking with the focal persons across these facilities on what we need, the responsibilities on our part and on the part of the facility, what you need to provide. Essentially, you need to provide, make available a room where the training will be conducted, beds, drip stand. I've also spoken to some of you regarding continence toilet chair. So whether you have the customized one or you can make the improvised type. I saw from one of the facilities this morning that there's a challenge in getting across to provide, and also to provide the patients, one or two patients that will participate in this practical session, because we don't have the demo equipment with us here. So we actually need patients to, and with this, you need to liaise with the neurosurgery unit of your facility to ensure that you're able to. But I think from research this morning was chatting with Dr. Uwebu, and it seems that most of the patients are outside Port Harcourt, but we will continue to discuss to see how we can get one of the two, of this patient to be present in your facility on the date we have agreed together. So that's for the on-site practical demonstration training. Then for the new facilities, please, you need to from now build up your data as you continue to get more, patients on your list. Please ensure when we come for the practical training, we will discuss this in details with you. So I do need to, build your data, because we actually need this data to, make case for the project and to know the impacts of whether we are, achieving the objectives. Shortly after this, the close of the training, we'll be sharing the slides, on the platform for all of us to, for continuous study and knowledge. We also have, just like last training, we have an evaluation form that we are going to drop on the WhatsApp platform. So it's a simple form, just open and complete the evaluation form so that it will enable us to know how far we've gone with the training and for future training. So then regarding the incentive for this training, we will be providing a token participation fee of 3,000, then data 1,500 per participant for this training. Having said that, we implore all of us to please put our videos on if you can. So let's put our video on so that we can take a photograph for this training. Unmute your microphone, put on your videos. Thank you. I should do that.
The teacher is not coming up.
So you can say something. The floor is open.
Hi.
Hi, everyone.
Good to see you.
Hi,
Thanks for the presentation.
We are going to type it,
not to be
not
to everybody.
Presentation. Thank you, Mr. Fajemilo.
For us to take it back to our unit.
Thank you, Mrs. Oje. Thank you, everyone.
Thank you, sir.
Thank you to Research Group. We can see you all. All right. If you have not dropped your name in the chat box, please endeavor to do so.
We want type see the host. We'll type onto Ram.
Don't worry, let me type it here. Okay, I will type it on my phone.
Don't worry, we'll type on me.
Thank you, everybody.
Let me type our name.
I'm sending. You're supposed to send it to him, so not to the other person. We are only sending it to the man, the Festus.
Bye.
Thank you. Bye.
Bye, everybody.
Bye, everybody.
Bye.
Bye, everyone.
Yes.
Lara, good to see you.
Lara.
Same here, sir.
Right.
This is OJ. Good to see you. Yes. Same here.
I know my video is not coming up, but I can
No
start
problem, no problem.
Okay, sir. How are you?
Okay, bye-bye, everyone. I think it's over. Thank you, Mr. Festus.
Bye.
Bye-bye. Thanks for the presentation, for the
You're
information.
welcome. You're welcome.
Thank you very much.
Bye.
Bye-bye.